Hello, I am doing my week 7.5 final part of my portfolio project reflection. I am here to tell you about how it has helped me in the Bryan and Stratton College workplace capabilities. As far as the first one, tolerance, goes, this class has taught me a lot about understanding different cultures and the need for different cultures in our places of employment and how to appreciate them and really just be more tolerant of the fact that people are different from me and I need to be more accepting, and definitely as a nurse be empathetic to that and understand that they are different from me and they do require different things to be accommodated than I would. Interpersonal skills, I'm going to be dealing with patients day in and day out of all different kinds of ages, shapes, sizes, cultures, religions, all kinds of things, and it's great to have interpersonal skills so that they feel comfortable talking to me and coming to me about what they may need to better their health care. Problem solving, there will be a lot of problem solving, whether I'm in the ICU unit or in a surgery unit with the doctor doing surgery. I'm going to have to be able to think quick on my feet if something were to go wrong and help them to problem solve and possibly save somebody's life. Dependability, I cannot be seen as undependable in the nursing world. They need to know that they can depend on me to treat patients with respect and tolerate their differences and depend on me to be able to speak with them and really just depend on me to be there as a nurse, be able to critical think and be able to problem solve on a dime. If they can depend on you, you will be forever appreciated within your company. Communication, it has definitely taught me a lot about communicating with everybody in the field, whether it's the doctors that I work for, my fellow nurses, or my patients. It's important to understand who you're communicating with and what they need from you. Perseverance, this class has taught me to not give up and to just keep going even if you don't completely understand. I'm sure there's going to be days at work that I feel are impossible to get through or nothing is going right, and I'm going to have to persevere through that because people's lives count on that. Persuasion, this class has taught me how to understand what other people may be trying to say to me to persuade me in a certain way, whether it be fallacies that we have discussed or lame advertisements where they try to group us in on the bandwagon. That might be a thing, but or it might be up to me to persuade patients to take their medication and take a certain brand no matter what they've heard on the other side of things, because they often will hear rumors that will deter them away from taking something that can be very beneficial to their health. Attitude, you have to have a good attitude no matter where you work. That's very important. If you're a miserable person, you'll be miserable at work, and it's very easy to let your emotions get the best of you. And this class has definitely taught us how emotional intelligence is extremely important because you cannot allow certain things to get to you while you're at work. You can do it on the cry at home, but you cannot do it at work. You have to have that sense of emotional intelligence, and I'm here to do a job, and that's what I'm going to do. So what can I do to get this done? It has also taught me enthusiasm in the emotional intelligence sense. It's easy to be enthusiastic about your job and about what you're doing when you feel confident in the decisions that you're making in that job, when you feel like you're good at your job and appreciated at your job. Productivity, there is nothing that screams productivity like critical thinking and analyzing. Those are the two things that you pretty much have to do in order to be productive as a nurse. You always have to be on your toes and you always have to be ready and thinking about what could happen, how would you handle it, and what can we do for the patient to stabilize them and get them back to where they're feeling okay. I hope that this was a good video and a good example of what these things have taught me, and I have thoroughly enjoyed this class. I think this is a great class for anyone who's going to go into nursing, because it truly does teach you how to deal with almost any situation with any kind of person, and that is a set of skills that is pretty much irreplaceable. So thank you very much.